moment.
So could you tell us what you're up to?
Okay.
Work-wise.
Okay, I'm a human givens therapist and a trained CBT therapist. I'm a clinical psychologist and I work in the NHS. And I've compared how CBT is different to human givens, what makes them different.
Yeah.
In some ways, one of the things that makes them different is CBT is very much more structured with an agenda at the beginning of each session, giving a very strict formulation at the beginning of the session. Of the treatment, and involves often a lot of writing down information, keeping thought diaries and keeping records of things. Human givens tends to use a little bit more imagery and is maybe less formulaic in terms of what writing things down, although both of them have collaborative tasks that person is asked to do. There's many commonalities between what you actually get the client to do. What I've done is I've gone through some of the main human givens trauma techniques and explained them to people. Some of them are the importance of our emotional needs being met, and if they're unmet emotional needs, we tend to be much more vulnerable to addictions, to anxiety and depression. Another thing that I've looked at is the human givens rewind treatment for trauma, which is a way of treating trauma where you don't have to go into any detail about the trauma in order for the trauma to be treated. And also you can treat multiple traumas in a single treatment session. And so that can obviously be cost effective as well for people. Obviously that only treats one aspect of trauma. It particularly helps with flashbacks and nightmares. So there's other treatment techniques. One of them is what we call molar memory treatment or updating of memories, which really helps with unconscious urges that people might have, where they know it's not a useful thing to be doing, but they feel drawn to it and compulsively do it anyways. Or also it's an imagery technique that actually helps people with their underlying negative beliefs, shame, that kind of thing can be very effective for treating that. I've also talked about counter conditioning, which is a way of really helping to consolidate new behaviours as opposed to those unhelpful old behaviours that people have. Now, I use all of those different treatment techniques, or a variety of them, whichever one is most appropriate for the people. I use them in a rewind clinic in the NHS, which is a single one-off treatment session. Their care coordinator or the person working with the client will come with them for the treatment session, and I will use a combination of those different treatment techniques to help them with their trauma. Usually after that, their flashbacks and nightmares have subsided and they're able to get other treatment, just the regular treatment for anxiety, depression, self-esteem or whatever other issues they've got. But for some people, they don't need any further treatment after that as well.
It's wonderful.
And I've also just kind of gone through, I've been collecting a lot of evidence for the rewind, different studies that have been done in different places, and both on the rewind, the effectiveness of rewind treatment, and also the effectiveness of human givens therapy as a whole. One of the studies involved, 1,180 people, which is quite a lot of people for a treatment study, and they found 83% people had either reliably improved or recovered completely as a result of the treatment.
It's very hopeful. Impressive,
okay. And some of the things that I'm involved in doing at the moment, some studies that I'm involved with. One is a qualitative study, which is finding out from the clients their experience of this rewind clinic, this single treatment session, and how they found that. Another study I'm involved with is looking at the rewind treatment and how it not only can treat trauma, but what we call sub-threshold traumas, which is kind of things that people find traumatic but doesn't meet the definition of trauma, which might contribute to their anxiety and depression.
Or their limiting patterns of behaviour.
Yes, or unhelpful behaviour patterns, absolutely. And finally, I'm involved with a student doctoral student in Oxford University, and we're going to be doing an RCT, which means a randomised controlled treatment trial on the rewind technique.
Very exciting.
Yes, it's really exciting.
Thanks very much.